I would knock on the door before I entered. I would state my name. I am Tori. I am a student nurse. I would perform hand hygiene, check the room for contact precautions. I would confirm the patient's ID by using 2 patient identifiers. The name and the date of birth. In this case, we'll do John Doe, and the date of birth would be October 1st, 1991. I would explain to the patient that we will be performing a respiratory and cardiovascular assessment in addition to assessing the vital signs. I have all my equipment. If I was in the hospital, I'd be there. I would raise the bed and remove the call light. I would ensure the patient's privacy and dignity, and I would apply principles of asepsis and safety. And then I would first begin by assessing the patient's temperature. I would make sure that they didn't eat or drink anything 15 or 30 minutes prior to the vital sign testing. And then I would also check for allergies, perform hand hygiene again. And then I would, obviously I already introduced myself to the patient. I would remove the electronic unit from the charging unit and remove the probe from the recording unit. Then I would cover the probe with a disposable probe cover and slide it on until it snaps into place. I would then insert the thermometer under the patient's tongue in the posterior sublingual pocket for a full period of measurement. I would instruct the patient to close their mouth around the probe, continue to hold the probe until I hear a beep. And then I would remove the probe from the patient's mouth and dispose of the probe cover. And I would return the thermometer probe to the storage place within the unit. And the reading I would have gotten would be 98.6, which is a normal temperature. I would then assess the peripheral pulse. I would select the appropriate peripheral site based on the assessment data. I would remove the patient's clothing to expose the site chosen. And then I would place my fingers I place the pad of my index and middle finger over the radial artery, and I would compress slightly. And I will assess the rhythm and the amplitude of the pulse for 30 seconds, and then I would double the rhythm by 2. And in this case, I would have gotten 40, so the heart rate is 80 and a 2+. And as I'm assessing their pulse, I also will stay there to assess their heart, or to assess their respiration rate. And while my fingers are still in place, after counting the pulse rate, I would observe the patient's respirations. I would note the rise and fall of the patient's chest, assess the depth and rhythm of the respiration. And I would have gotten 8 breaths over a 30-second period, times 2 would be 16 breaths, which is within the normal range. I would then go to assess the blood pressure. And since I'm here by myself, I have a difficult time doing it on myself, so I'm just going to explain it. But I would perform hand hygiene, and I already introduced myself to the patient, and make sure the patient's feet were flat on the floor, they're sitting, and I would palpate the radial. I'm just going to do it on one side, but it would be done on both. The radial artery, and if the pulse is stronger on one side, that's when you would typically use, but in this case we're just going to select the right arm. And then I make sure I determine the right cuff size, and then I would put the cuff, it's a little difficult just to do it myself, I would put the cuff right about here, about an inch or 2 above where my elbow bends. And then I would also then palpate the brachial artery gently and observe with this sphygmomanometer while inflating until the point I can no longer hear the pulse. And then I would quickly deflate the cuff, and that would add 20 to 30 millimeters of mercury to that number. And then that's where I would inflate it, and then I would have my stethoscope in, and I would put my stethoscope and this is wrapped around my arm. I'd put the stethoscope sort of under like this against my artery, and I would inflate the cuff, and I would inflate it to that maximum level, and then I'd begin, after I reach that level, I would begin deflating it by opening this little valve right here, slowly, and a deflation rate of about 2 millimeters per second. And then the systolic pressure is the point at which I first hear the faint, clear sound that is audible, and the diastolic is that with the sound I no longer hear. And in this reading, I will have gotten 110/70 for the blood pressure. And then next we would assess the respiratory system, and I would perform hand hygiene before that. So just one moment.